name is Muhammad Aqsha V. I am here from Sociology major in Social and Political Sciences, faculty on Nasional University, Jakarta. And this is the video review about the condition and impact of COVID-19 on rural social and economic changes in Asia as the final test of Adilita Pramanti's rural sociology class. In this video, I want to share something that how COVID-19 affects on rising prices and how it affects on rural areas. The COVID-19 pandemic has bring crisis to our daily life that we have to face, especially in our agriculture sector. Our daily needs, such as animal protein, cotton and dairy products, have the worst impact sector. According to Dan Kowalski from the CO Bank Knowledge, the causes vary that COVID-19 impacts brought us that have a chain reaction from the collapse of the crude oil market to the loss of food service sale, that making the price has rising up to the sky and also making general economic weakness. This price impacts still running on as we expect price persistent through the spring season before starting to improve on the summer months. Kowalski also defined about how rural health facilities having a struggle due to the COVID-19 pandemic, where they cannot provide a better health care that much to the patient exposed with COVID-19. Like in the United States, rural counties have estimated only 5,600 ICU beds across the entire country. It is same case in Indonesia, where rural areas, which means has more dense population, are having a bad road access and poor quality of healthcare facilities. Most of it are C-class healthcare facilities that making it more likely to collapse than successfully recover patients with COVID-19. The most severe sectors that impact most is supply chain. It will bother labor-intensive industries and will generate worker shortage, which means will hold crop harvest and slowing meat production. Dependence on food service channel will result in major revenue loss. This will cause us dealing with food vulnerability and also collapsing the rural areas if the crisis continues. To build and develop rural areas and to prevent any collapse on rural areas based on how COVID-19 crisis has affected our agricultural sector, the theory that relevant to manage the rural areas development is the Herod-Domar theory about savings and investment. The Herod-Domar theory assumes that economic growth is determined by high savings and investment. If saving is low, then the economic will be low. Herod-Domar theory assumes that the development problems are basically capital investment problem. These savings can be obtained from village funds provided by the government sourced from the Indonesian National Budget (APBN) that are intended for villages to finance governance, development, community development, and village community empowerment. This village fund program is made through Law No. 6 of 2004 concerning village. The government of Indonesia carries out a significant evolution by giving higher authority to seek to the lowest level of regional government, namely the village level. Actually, this village funding program is not new in Asian countries. Until 2009, several states had implemented similar policies, namely Vietnam through the Vietnam Bank for Social Policy, Bangladesh through the Grameen Bank, BRAC and ASA, India through Spandana, and Thailand through the Village Fund. Thailand is one of the countries considered successful in implementing a similar policy through the Thailand Village and Urban Community Fund, or VF program, which was initiated in 2001 and was aimed at 74,000 villages and more than 4,500 urban communities. These savings can be used to anticipate any crisis that can cause global economic collapse. So, rural areas can survive if any crisis occur in the future. And also, agriculture sector can be more sustained and not so get affected on how prices will be changed. Thank you.